that for this country. So I am a leader you can trust to get America back on track. And finally, I'm a leader you can trust because I'll never forget what it means to be a public servant. I'll never forget what it means to serve our great country. I'll never forget what it was like to be a young Marine in the mud, sleeping in the mud every night, even when I'm working in the halls of Congress. And I'll never forget what it means that when I was there, just as I was a platoon commander who always ate last after my men, I'll never forget what it means to be in Washington to serve you, to serve this district, and to serve our great country. So I am a leader who you can trust, will always remember what it means to be a public servant. So for these reasons, I'm a leader you can trust to preserve Social Security and Medicare. I'm a leader you can trust to get this country back on track. And I'm a leader you can trust to never forget what it means to be a public servant. That's why I'm here today, and that's why I look forward to serving you in the 6th District. Thanks very much.
Thank you, Mr. Moulton. Our last candidate is Marissa DeFranco. Marissa DeFranco has served as chair of the Massachusetts Bar Association's Immigration Section Council, chair of the New England chapter of the American Immigration Lawyers Association, liaison to a federal government agency, and is director of American Immigration Lawyers Association National Board of Governors. Marissa has been honored as a top woman of law by Massachusetts Lawyers Weekly and received the National Legal Aid and Defenders Association's Beacon of Justice Award for her pro bono service. As alumna of Suffolk University Law School, DeFranco worked in the staff's attorney's office at the First Circuit Court of Appeals and as a victim witness advocate in the Cambridge District Court as part of Suffolk's Battered Women Clinic. She is former commissioner of the Massachusetts Commission on the Status of Women. Welcome, Ms. DeFranco.
Thank you. It's actually pronounced Marissa DeFranco, but you don't need to memorize that because after September you can just call me, and November you can call me Congresswoman. So I am Marissa DeFranco, and as mentioned, thank you everyone for being here. I am an attorney in the district. I've been an attorney in the district for the last 17 years. That means I run my own small business. That means I represent small businesses across the district. And those small businesses pay the payroll tax that supports Medicare and Social Security. So let's talk about a record, and let's talk about something real for a change. What's real? What's real is that the economy is hurting, jobs are not being created by the big corporations because they don't have to create jobs. They can continue to squeeze the productivity out of their current workforce and not create any new jobs and still see their bottom lines fatten up quite nicely. While the rest of us out here in the real world work harder and harder and harder to make ends meet. Let's talk about how we create jobs in the small business world and on Main Street to support the taxes that are required for Medicare and Social Security. I'm the only one in this race who has that experience. Through my clients creating jobs, cutting edge jobs, innovators, entrepreneurs across the district and across the Commonwealth, and myself. But let's also talk about my record on when it comes to fighting for people's rights. I'm the only one who has the real world experience fighting on the front lines, in the courts, on my own dime often because I do a lot of pro bono work. As mentioned, I won a national award for my pro bono work. None of my opponents can claim to have done any of this work on their own time or their own dime. And often my representation includes seniors. That is my record. Also my record is that I'm the daughter of a physician, a retired physician, and a retired nurse, my mom and dad. My dad's the doctor, my mom's the nurse. Although sometimes you might not know that if you met both of them, because my mom is pretty tough and pretty smart. In fact, she was a pediatric surgery nurse in the 1960s. So if people think I'm tough, you should meet my mom. But the important part about my parents is that they ran a very successful medical practice until the federal government and Congress made it harder and harder and harder because they never kept a watch on the health insurance companies that got bigger and bigger and bigger. And then what happens? My father's practice had a lot of people who were on Medicare, and eventually he retired because a doctor can't see 15 to 20 patients a day, especially people on Medicare, and have a surviving practice. So that leaves all of you out there and all the seniors we care about in our lives without good medical practice. I'm going to, answering the questions, I'm going to tell you the actual ideas and solutions I have to change that. But my record is seen on the front lines where seniors are getting the short shrift because they can't get adequate health care in this country and Social Security is at risk. So I will explain those details in my answers shortly. What's the last thing you need to know about me? What you need to know about me is that I say what I do and I do what I say. I'm the one who has the track record in the real world fighting for people without power and people without rights. And you might notice one other thing that's different about me in this race. I'm a woman. And to all those senior women out there, I'm the one who has been representing you and your rights, whether it's women's rights, disabilities rights, or senior rights. I'm the one who has held your hand and listened to your stories and been there with you for hours and hours and hours. Again, sometimes on my own dime when necessary, because when I start a fight, I might not know it's going to take me 103 hours of legal service, but I'm not going to abandon you in the hour of your need because I might not get paid. That's my record, and I really, sincerely, respectfully ask for your vote. Thank you.
Thank you, Mr. Franco. At this point in time, we'll move to the question portion of our format, and I'll turn this over to Mary Margaret Moore.
Thank you, Scott. So these are the candidates that you're going to be voting for. Think about it. Listen to their answers. Again, why are we doing this? A group of us got together about 10, 11 years ago from North Shore Elder Services. Paul Antikos is here representing that organization. Senior Care, Scott is representing that organization. Greater Lynn Senior Services, as well as an agency that's recently changed its name, Element Kea, that you might have known it as Elder Service Plan of the North Shore. I see Bob Wakefield is here. As well as the North Shore Career Center, working with the Independent Living Center of the North Shore and KPN. We decided that people of all ages living with disabilities, with all types of disabilities, and seniors were not getting full, immediate, coordinated access to what they needed to live their lives. Here we are now, 2 years since we've incorporated. And the folks down in Congress, as you know and have seen, they decide what's going to happen to our lives and our access to housing, employment, rights, healthcare, and everything in between to enforcing the ADA, Americans with Disability Act, which is coming up on its 25th anniversary and still isn't even fully implemented. So, we have pulled together some questions, and the first one, and I'd like to start with John Patrick Devine. I'd like to ask you to speak for a 2-minute response, please, if you can. For 40 years, Medicare has been the mainstay for older adults and many adults who became disabled after being employed in providing coverage for their Medicare costs. What is your sense of the future of Medicare? What would you do to preserve it for generations to come? Thank you.
Thank you. Well, it's a good question. Everyone relies on Medicare at some point, paying into Social Security, and you look forward to that entitlement when you get older. I said before in my opening statements that efficiency is one of the real problems where we can improve delivery of healthcare and lower costs for everybody. Part of that is fraud, in fact. I mentioned the APA, the American Psychiatric Association, was talking to Congress and the National Neuroscience Caucus about instituting screening, genetic screening, in terms of preventative healthcare. Preventative healthcare is shown to lower costs, and taking steps and measures and programs to help in that area will help dollars go further. It'll also help limit fraud, actually, in certain cases. The bottom line is that money needs to be found, and in some cases you just can't pull money out of thin air. It doesn't grow on trees. So you have to make your dollars go further. I talked about how 50% of healthcare costs are incurred by 5% of the population who have chronic healthcare needs, who visit emergency rooms over and over again. If we were to establish physician access centers where pockets of people with chronic healthcare needs tend to cluster together, that'll help lower the costs for everybody. There are other measures that can be taken to help re-endow Social Security, help re-endow Medicare, and finding dollars from other areas, such as international corporate taxes that are hidden overseas. In creating more jobs creates a larger tax base, and having a larger tax base will create even more dollars to help address this area of need. Thank you.
Thank you. And John Guda, would you answer the same question, please?
As I said in my opening statement, health care for our disabled, sick, and elderly should not be cut. It should be expanded. And it can be expanded because it requires only three things: raw materials, labor, and money. We already have the materials. We already have the labor, either homegrown or imported. And if we replace Reaganite tax and monetary policies with capitalist tax and monetary policies, we will have enough money to pay for that expanded care forever.
Thank you. What I'd like to ask you to answer, if you wouldn't mind, Richard, to say is, for 80 years, Social Security has been a primary source of income for older adults and for adults living with disabilities. What's your sense of the future of Social Security, and what would you do to preserve it for generations to come?
Well, first, I just want to go on record. I think Social Security is probably the most successful program that we ever enacted in this country. We have 50 million people who are benefiting by it. Right here in this congressional district, there are 141,000 people who receive Social Security benefits, 107,000 seniors who receive benefits. This really has enabled our seniors to live a very comfortable and healthy life. Sooner or later, though, we do have to recognize that we have a problem with Social Security. The President of the United States has a group of trustees that each year issue a report on the solvency and the condition of Social Security. They issued their report on July 28th, and when they issued their report, they said that there's enough money in Social Security right now to last until 2033, after which time the Social Security fund will only be able to pay out 75% of benefits. So everybody knows that we have this problem that's coming up, and the question is how are we going to deal with it? If we address the problem sooner, it's going to be easier to fix. If we procrastinate and do what Congress does, turn a blind eye and pretend there isn't a problem, inevitably the day of reckoning will come, and when that happens, it's going to be very difficult to fix. I would just say that it's happening because of demographic changes that have taken place. In 1960, there were 10% of the population were senior citizens. Right now, we're getting up to the point where 20% of senior citizens. In 1945, when Social Security was first established, there were 16 workers for every recipient. Right now, there are less than 3, and that number is continuing to go down. So obviously, making sure that we have a solvent Social Security system is very, very important, particularly for the younger people who are coming through. And I just want to let you know what my priorities would be as your congressman. First, I would not vote for any benefit cut for any current recipient of Social Security. We made a promise to our seniors, and we need to keep it. President Obama has come out and said, you know, we should change the cost of living calculations. It would cost about $135 billion over 10 years. Recipients would get less of an increase, and they don't even get really much of an increase right now, so I would definitely not support that. I would not support any raid on Social Security Trust Fund that diverts money into other programs. I'd support lifting the cap of $106,000 for Social Security tax. It doesn't make any sense that somebody can make $100,000 and somebody can make $1 million and still pay the same amount into Social Security. So I think that we need to adjust that, and that will help do a lot to make the system more solvent. I'd allow people to put more money into IRAs and 401ks to save for their retirement. I'd support eliminating the Social Security tax for those working beyond the retirement age. And most importantly, I think we all need to recognize that in order to get Social Security solvent and healthy again, we have to get people back to work. We have the lowest workforce, lowest number of people in the workforce right now than at any time in the last 40 years. People are underemployed, people are working part-time. If we can get the economy going again, all of those people are going to be paying Social Security taxes, and the fund is going to become more healthy. Finally, and most importantly, in order to solve this problem, we need to have leaders, bipartisan leaders, who aren't going to point fingers, Republicans did this, Democrats did that, who are willing to work together. We need Ronald Reagan and Tip O'Neill back in the Capitol, who both principled people, but both people who were willing to sit down 30 years ago and give up a little in order to make sure that the program was solvent. We don't have that right now in Washington, and I want to be one of those people who can work across the aisle to come up with a solution to make sure that we preserve and protect this program for the long run.
Congressman Van Keely, would you answer the same question? For 80 years, Social Security has been a primary source of income for older adults and adults living with disabilities. What is your sense of the future of Social Security, and what would you do to preserve it for generations to come?
Well, thank you, Mary Margaret. First of all, without pointing fingers back and forth, it does make sense to have people be accountable. And one of the things we need to do is make sure that we have a majority in Congress that will work with the President. Just like Mr. Reagan and Mr. O'Neill, we can't have a Republican majority in Congress suing the President of the United States instead of extending a hand to work on serious issues like this. And we can't have a Republican majority out there saying that as long as they're in charge, they're going to try to privatize it. So the first vote that my Republican opponent would make in Congress is to put that same majority back in power that has made this a stagnant Congress for the last 2 terms. I'm proud to have served in the Congress from 2007 to 2010. It was a Democratic majority where it was the most productive Congress since 1965. Right? We passed legislation, over 70% of it was bipartisan. 2 years there was a Republican president, 2 years there was a Democratic president. That's the way we need Congress to work, and particularly with issues like this. We do not need to privatize Social Security. We do not need to raise the age of people for retirement. We do not need to have a changed CPI that is going to take away benefits from seniors, but we do need to have a plan. And I suggest one plan is legislation that I co-sponsor, which in fact would change the CPI to have it be the consumer price index for elderly citizens, so that the things that seniors buy will be what's included in determining what the cost of living will be, and that will increase the cost of living increase every year for seniors, which is desperately needed. I support in that same bill the prospect that we will have a cap removed. Right now, you have $117,000 of your income is subject to withholding tax. There's no basis for having that stop at that point in time. This is America. Everybody needs to contribute to the retirement security of every senior so we can lift that cap, and that in itself would be a substantial improvement into this program and strengthen it as we need to do going forward. You know, 1 in 3 seniors rely on Social Security for 90% of their income. 6 out of 10 rely on it for more than half of their income. Before we had Social Security, almost half of the Americans in this country lived in poverty. We don't need to head back in that direction. The trustees have said that this program is going to be solved until 2033 if we don't do anything. We can't afford to not do anything. We should pass the legislation that I co-sponsored to strengthen that and move that program beyond that measure. And we can do something more. We can make sure that we have a majority in Congress that really puts its money in its mouth right where it should be, to support seniors, to support this as a priority, to make sure that Social Security is strong, to stop suing the president, but to work with him on serious issues like this. I'll continue to do that. I've done it, as I said, in 2005, making sure we didn't privatize Social Security. We stand there to extend our hand again to work with Republicans or Democrats or independents to make sure that Social Security is strong and Medicare is strong. Thank you.
Seth Moulton, I'd like to ask you a question regarding Medicare benefits. Since the onset of the program, Medicare benefits in a skilled nursing facility are available only after a qualifying 3-day stay in a hospital. Demonstration waiver initiatives, including one conducted by Mass General Hospital, have shown the benefits to both the patient and the taxpayer of permitting direct admissions to nursing facilities for patients with known conditions. Would you be in favor of eliminating or modifying this provision?
Thank you very much, Mayor Margaret. Quite simply, this provision needs to be eliminated. It's a great example of where the Medicare rules and bureaucracy get in the way of providing good care for our senior citizens. We need to push responsibility away from national standards and rules and put more decisions in the hands of healthcare providers to make the right decisions for care of their patients. I know this pretty personally because I get my health care from the VA. And the VA is a system that is roiled by a broken bureaucracy. By a bureaucracy that was designed for a different time, a different age, a different set of veterans. And it's not serving us today. In the same way that we need to bring reform to the bureaucracy that runs the VA, we need to bring serious reform to rules like this in Medicare that take decisions away from doctors, farther away from patients, and put them in the hands of Washington rulemakers. There are many nursing facilities right here in the 6th District that are ready to receive patients and will provide them better care than following this rule. I want to make one other comment too, which is that I agree with the Congressman that it is very important in this election that we preserve this seat, that we keep it Democratic. And you don't have to take my word for this. National Journal was unequivocal. It said, Democrats' chances of holding this seat increase markedly if Moulton wins the nomination. So with all due respect to the Congressman, we need the strongest Democrat that we can going into the final election. Some local newspapers have referred to me as Seth Moulton, Richard Tassay's worst nightmare. Richard, I'm sorry for that. But that is the reality of this election. When we go into the polls on September 9th, we need to pick the strongest Democrat that can keep this seat blue and to ensure that we have the resources to win back seats across the country. Thank you very much.
And Marisa DeFranco, would you answer the same question, please?
But first, I am going to have an adjustment because I am a girl. And does it come out? Can I just say that? Well, seems like no one's really sticking to script, so I have a few things to say, Mayor Margaret, if you don't mind, before I answer the question. All right. Before John or Richard get into the Republican and Democrat back and forth, Mr. Tierney has to clear a primary, and Mr. Moulton, I'm actually also in this primary as well. And disregarding what the papers are saying, people on the ground need to know one thing. I'm the person in this race with the real life experience. And also, Congressman Tierney, as Democrats, we don't get brownie points for voting to protect Social Security and Medicare. That's standard, that's baseline. What the people of this district need, what the hardworking people need, is somebody who actually has new ideas and innovative ideas. For example, on Medicare, you want to have healthcare costs come down and Medicare costs come down and Medicare available for everyone in this room and your children and grandchildren in the future? Get the Department of Justice to do its job. And one of my first actions in Congress would be to make funding to the Department of Justice contingent upon their prosecuting the monopolies of the health insurance companies that are driving the costs of healthcare way up. And I'm the only one, again, with that direct experience because I watched my mother and father fight over and over again with health insurance representatives. My mother would be on the phone with a health insurance representative, and that representative, not an MD and not an RN, would tell my mother to tell my doctor how to practice medicine. Those days are over if I get to Congress. So, we have history for this. We break up the monopolies. We did it with Standard Oil, we did it with Ma Bell, and the health insurance companies, if they just get bigger and bigger and bigger, they are only going to do one thing: increase the cost of health care through the roof. Because we don't have health care in this country, we have health business. And as the daughter of a physician and the daughter of a nurse, I will go to Congress to make sure that access to health care is there for you and Medicare is there for generations. For Social Security, here's another innovative idea. I didn't need to hire some high-priced consultants or go to a think tank to come up with it. I came up with it because, again, I'm on the front lines working every single day in the real world. And that is, you have big corporations paying people as independent contractors. What does that mean? That means they don't pay payroll tax. The independent contractor does, the self-employed person pays that payroll tax, and that goes into the fund for Social Security and Medicare, but it doesn't go in from the business. So how about, again, our administrative agencies doing their job, instead of going after the little guy and the small businesses and investigating them, how about they investigate the big companies that are not paying their share of our payroll tax in this country? That will keep Social Security solvent. And finally, Mary Margaret, on this question. You know, you have to follow the money. So again, with my father being a physician, I want the decision to be left up to the doctor, because this is a fight between the hospitals and the nursing care homes, let's be very clear. And so if you give everything to the nursing care homes, what are they going to do when they have a captive audience? They're going to raise the prices too, just like the hospitals have done. So we can have waivers, and we can look at them on a case-by-case basis, because not every patient is the same, we know that. But let's make sure that we're not just shuffling people off into nursing care facilities when what they really need is emergency care services and a hospital stay. And again, we break up those hospitals, we do our job in stopping these conglomerate mergers, turning healthcare into health business, and we actually deliver healthcare in this country. Thank you very much.
Thank you very much. While you're there, why don't you just stay there?
Okay.
I'm going to ask you a follow-up question.
Sure.
More and more Medicare patients are being placed on observation status instead of being admitted as an inpatient when they seek hospital care through an emergency room. This results in significant expense for them, as well as make them ineligible for Medicare-covered care in a nursing facility or home care after they leave the hospital. Do you support this policy? If not, what would you do to change it?
Thank you, Mary Margaret. No, I don't. And unfortunately, I did have a recent experience with this very issue. My mother-in-law recently had a stroke in Queens, New York, is where my husband is from. And she's 88 years old, and they had her in the hospital, sitting on a gurney in the hallway for more than 24 hours because they didn't want to admit her into a room. Now, I don't know what's happened to healthcare. I do know what's happened to healthcare in this country. The big insurance companies are in control, and the big hospitals are in control. And my mother-in-law is the toughest woman you've ever seen in your whole life. She fought communist soldiers in China when she was there by herself because my father-in-law was already here in the U.S. And then she fled and came to the U.S. to fulfill their American dream, starting with nothing, You want to talk about poor? They were dirt poor and lived in the back of their laundry and raised 7 kids who all went to college. That's the American dream. Only for her to end up at the age of 88, still strong as an ox, until it turned out she had a mini stroke, but very devastating, and she's still recuperating. Thankfully, she's still with us. So I'll give you the good news first. But for her to go through all of that, to end up on a gurney in the hospital and not being admitted, because you know what they think. They think, oh, this woman's 88 years old, she's on her way out, let's just see what happens in the next 24 hours, and then if she's still here, we'll give her a room. That is not my America, ladies and gentlemen. And again, as somebody not with just this personal experience, but who has represented senior women and men on fixed income, again, on the front lines, trying to help them get benefits, helping them with all of their needs and advocating for them. I'm the only one in this room with that experience. And how do we change that? We take the control away from the hospitals, away from conglomerations and the mergers and the health insurance businesses. We make the